So first, just to kind of start out, I wanted to kind of honor, I think, the elephant in the room about what happened on Tuesday and the kind of sadness that I think many are feeling and the kind of stress that might be kind of permeating in the environment. I think it is, can disagree about lots of politics, but I think about the work that I do and how the potential new administration, I don't think will be as supportive of some of the social programs that I'll kind of talk about in the back end of the talk that I do think serve those that are economically marginalized and dealing with financial hardship. So I have a little bit of a bias in that, but I think that's important work that the government should be doing, and I don't know if they will do. And now, while that is saddening, I actually wanted to kind of really kick off my talk with that as context, actually from a quote from Barack Obama, which is Obama kind of noted that the arc of the moral universe is long, but it bends towards justice. Many may have heard Obama say this before. Interestingly, notably, it's actually a quote from MLK. So Obama kind of stole it, but he both stole it and omitted, I think, an incredibly critical component, which is the arc of the moral universe is long, it bends towards justice, but only if we pull it. And I think we'll come back to that and note that right at the back end of this talk about thinking about how to pull and how to move. But because of all that and realizing that it's past 4:30 and you guys may have already had a long day or week, I wanted to give some of my key takeaways at the front end. So, and I'll repeat these, and we'll see the data for them. But what I'm going to talk about is that socioeconomic status, exposure to poverty, financial hardship, we could use a lot of different names for it, is consistently linked to differences in the frontal lobe, hippocampal structure. So how big or small different parts of these critical brain regions are. We think that these differences might explain socioeconomic related disparities in executive functioning and academic achievement. I'll talk about what executive functioning is in a couple of slides. We also have been finding that socioeconomic status is related to the discounting of reward. So preferring a more immediate and large reward compared to a reward you might have to wait for. And I'll talk a little bit about some new work kind of looking at value-based processing, reward learning, and how that might be connected to socioeconomic status, poverty, and mental health. The last kind of thing that I'll go into is talking about the multidimensional nature of poverty and how we all think we may have some sense of what poverty is, but we may be a little bit wrong, or at least lamentably incomplete in how we define these things. And then try to leave with a little bit of hope. I'm talking about lots of different ways that the needle may be movable, even for those living at or below the poverty line for small amounts, living on small amounts of money every year. I have basically about 4 big sections to the talk. We'll see how well your attention lasts, but I'll talk about some background of this work just as a little bit of predicate, just so you kind of get the kind of like broad motivation for things. I'll talk about some of the newer stuff on reward and decision-making. I'll get into a little bit past halfway. I'm starting to think more holistically about socioeconomic status. Sometimes we talk about income or poverty, and it's really kind of missing some of the both. There's a lot more that I think we need to think about as we think about those who don't have enough in this country. And then what we can potentially do with this and how hope may not be lost. So first, kind of getting into the background and some of the really early work that Martha was talking about when she gave the intro. So the first thing to just honor and kind of note is, and this will come through a bunch of different ways, is poverty is kind of, I would say, a multidimensional threat to development. There are many different kinds of experiences that are happening in economically marginalized contexts that may impair development, different forms of development, but they kind of come in a lot of different flavors. We could bend them in lots of different ways, but just to kind of frame you all, you can think about the material. So you just don't have enough. You don't have good housing. You don't have money. Connected to a lot of these things is the socio-emotional. So there's challenges with stress exposure, and it could be from the big into the small. And then I think about environmental threats. So we all kind of know, the notable case of Flint, Michigan, but I live in Pittsburgh, where there's still lead pipes everywhere. So there are multiple different things happening that can potentially influence and impact development. So just kind of get real into the data of that, here's actually some work from some colleagues at Cornell, kind of just talking about common stressful experiences that happen to some low SES versus high SES people. On the horizontal axis, percentages of folks reporting these things. On the vertical is the kinds of stress. And what you see across a kind of panoply of challenges is that the turquoise bars, the low SES families, report more. They sadly report more violence, more noise, more family turmoil, more separation. And we can think about how there may be structural factors that are causing some of these difficulties and challenges to occur to those folks. So that's kind of a quality element to it. There's also a quantity element to it. So same research group kind of looked at the number of stresses people were reporting. That's on the horizontal, and the vertical is the percentage of folks. And we see kind of this shift where folks that are in low SES environments report more stress, more challenges. And so there's points, whether it's a structural systemic element or whether it's money being able, kind of in a connected sense, being able to help us out of the jam. There's this kind of quantity and qualities of challenge happening. So we can know all that. And what we can also have seen or understand from a lot of other research is that exposure to poverty and the kind of all the challenges that are connected with it are really related to a lot of different domains of functioning and differences in well-being across the lifespan and across lots of different places of functioning. So exposure to childhood poverty is related to some increased rates of depression, some challenges with aggression, some challenges with academic performance, and some occupational and financial success. This isn't to say that all people who are economically marginalized have these challenges, but it is to say that these are increased. And I think this is true across a lot of large-scale data sets, across a lot of phenotypes data sets that might be smaller in size. But people see this across a lot of different contexts, a lot of racial and ethnic groups. You see these same things, whether we look at the potentially rural poor or predominantly white samples that have suffered economic marginalization, or all things in between. And so while this has been really well replicated and well studied, the mechanisms linking these things is really poorly understood. We don't know what it is about poverty that might kind of convey these elements of risk across a lot of different contexts. And this is kind of where my work has always kind of nestled in. There might be some potential power in brain imaging that helps us kind of understand what's going on. It might be able to help us think about mechanism. It might be able to help us think about subtyping. Maybe there's groups of individuals who show different kinds of brain activity or brain structure that then may go on to have certain kinds of problems or have no problems at all. And I think we can use this as another level of analysis to understand that risk as well as the resiliency. But this is where it really started out with a pretty basic question, which is just what brain regions might be related and associated with exposure to poverty. So maybe this comes in other speakers in the center, but I draw a lot from non-human animal research. I don't do anything with rats and mice, but I read a lot of papers about rats and mice. And part of it is just because you can control really exquisitely what happens to those animals, those organisms. And so there's a lot of nice work using lots of different kinds of manipulations. There's been a bunch of work looking at basically what I think is a pretty ecologically valid model of non-human animal stress, which is what's called limited bedding nesting. So some researchers, with notably Talia basically takes out all the bedding, all the sawdust that you normally get, and you think about a pet store in a rat's cage. And what happens is those mom rats are raising their new pups, and they're kind of stressed out. They literally just have material hardship. They don't have the basic material they need to build a nest for their kids. A lot of those moms are basically super moms, for lack of a better frame, and they try to still do all the kind of parenting things and all the kind of parenting pieces, but these kinds of stress manipulations, as well as other kinds of models of stress, have found that it alters neurobiology. A lot of times the traction of neurons, what we call dendritic branches, dendritic arbors, become smaller and shrink. There's also a reduction in new neurons. So basic neurogenesis and cellular growth is sometimes retarded after these kinds of experiences. So these are kind of different kind of standing in slides that kind of show the growth of new neurons, and they're reduced in these non-human animal samples that are exposed to these kinds of stress. So that's some of the background. And then what we wanted to do is really focus on, to start, just because this was early days, many of you were like still in high school, maybe even elementary school, I don't know, to look at kind of two big brain regions to start to think about as candidate areas that might be impacted by these kinds of experiences. The first is the frontal lobe, shown in blue here. And one of the reasons we might think about the frontal lobe is it has a really protracted postnatal development. So I won't ask for a show of hands, but much of the audience might be younger than 25. Frontal lobe is still developing up until at least 25. We sometimes argue about exactly when it's kind of fully done, but there's massive postnatal development happening between infancy, childhood, and adolescence. It has a kind of incredibly important and privileged role in these things called executive functions. So I'll talk more about this in a sec, but these are kind of control processes that help us plan, think, and see into the future, make ways to guide our behavior, control what we're doing, and hopefully execute our goals. The other brain region that kind of came up a lot, because this had been coming up a lot in non-human animal work, was the hippocampus. The hippocampus, people have done lots of work with stress or environmental enrichment, and they found that if you kind of really stressed out an animal, or you beat it like a really kind of kick-ass cage, for lack of a better frame, there's a big influence of experience. So animals that had suffered stress had reductions in their hippocampi, and animals that had suffered or lived in enriched environments had growth and expansion of their hippocampus. And the hippocampus has been really involved with learning and memory. We can talk about what it might be doing, because I think that's still a little bit of an open question. But it was kind of these kind of key candidates, I think, to start with. So what we did, just as a starting point, was we had a bunch of longitudinal MRI studies, a bunch of longitudinal MRI scans, about 820 collected from about 300 participants. They were between about a big age range from childhood into early adulthood, but we had multiple scans from the same people. On average, they were about 12 years of age. And we started just with this really kind of basic thing that I said. We're going to look at the size of the volume of the frontal lobe and the hippocampus. The nice thing was that the data is longitudinal, so we could look at these things over time, not just cross-sectionally, and that's because cross-sectional data has some limitations, but being able to see these changes as kids were turning into adolescents, adolescents were turning into young adults. So, getting into the data. What I'm going to show you here is age on horizontal, on the vertical is frontal lobe volume, and here's the basic development of the frontal lobe for more affluent participants who are at about 400% of the federal poverty line. FPL, as I would call it, is about $24,000 a year-ish for a family of four in the continental, United States. So you can think about you're getting almost into $100,000 a year, which is work is a little dated, but that's still a pretty affluent, space. So this is what the brain that's how the frontal lobe is developing. But when we look at the economically marginalized kids, so the families that are making $30,000 a year or less, what we see is a bit of a blunting or a diminution. And so basically, the kids who are at or below the federal poverty line have about a 7% difference in the volume of the frontal lobe. Where at points, there's times where there has been some overlap in the size of these brain regions, but then it kind of doesn't grow as large. And so we think about that as potentially marking maybe having less tissue to actually kind of do the functions of the frontal lobe. Again, I should note, this isn't for all participants that have suffered kind of living in economic context, but this is what we see at a group level. So These things have been replicated now by a couple of different groups. We also have replicated this volumetric difference in the hippocampus in 2 or 3 different reports now. And I don't have data for it here, but this is a sample of about 75 participants, but we just found the same SES hippocampus finding in about 2,000 participants. So basically, with greater levels of poverty, lower socioeconomic status, we see smaller hippocampal volumes. And one thing that kind of came up and that Martha referenced in her intro is really thinking about, okay, you're seeing these differences, but when are they occurring? When it might be, when these things be happening and popping up in development? And so we did a really interesting study focused on infant brain development. Here's actually my now 7-year-old, but this is her as a kiddo. We didn't scan her, but we did scan a couple dozen babies. Baby brains are really hard to actually kind of work with analytically. Basically, the brains are, for lack of a better term, they're kind of squishy, which is especially just after birth, you have a lot of different brain tissue that is both myelinated and unmyelinated. Basically, myelin's the kind of fatty coating that helps, like, basically insulate big tracts in the brain that have to get information around. But over time, you get kind of more kind of brains that look like kind of standard adolescent and kid brains. But what we did, we were interested in trying to see if we could see these differences, especially in the frontal lobe, really early. And one of the reasons we were interested in that is because many times kids from low SES households enter school a little bit behind. They enter school behind for a lot of different reasons, both structural and otherwise, but there may be gaps in language and other cognitive abilities. So the first kind of maybe touch point of being able to interface with public systems, there may already be neurobiological differences. And there's also some work, it's a little on the kind of potentially complex side. There's a Nobel-winning economist named Jim Heckman who argues that really early development is the best time to invest, that a lot of the major changes in emotion regulation, what he would call non-cognitive skills, things that are critical for working together, being dedicated, working in a team, really get set down pretty early. And experiences before 5 have a big impact. So we've kind of said, will we see any differences? Will we see any differences at all? And when will we see it? And so our kind of starting hypothesis was that the frontal lobe would begin in a very vague sense we start to see these differences before 5. And so what I'm going to show you here is about 85 infants that were scanned repeatedly. And there's going to be 3 lines that kind of break up socioeconomic status into low, medium, and high, ages on the horizontal, volumes on the vertical. And what we start to see is at points in development, there's a good bit of overlap early in development, so a couple months postnatally. But you start to see the stratification and breakdown where the low SES kids that are shown in this kind of lighter blue color, we start to see differences, really open up, in the 20 months of age. And so the higher SES in babies are shown in green. So that was already a lot of data. But to kind of give a quick kind of summary of all that, we see the SES is really related to variations in the frontal lobe and the hippocampus. We think that these might be related to executive functions, create issues for attention or memory. And we think that the hippocampus might relate to things like memory, learning differences, or maybe some stress responding variations, but I'll come back to that. And some of these differences emerge pretty early, which is a bit of a depressing fact. But the only thing I would kind of say is the brain is still quite plastic. So even though we may see these differences early, there's still a lot of kind of brain growth to be done and a lot of change to be had. So we had kind of a really basic kind of follow-up question, which was just, what are the potential behavioral consequences of these neurobiological differences? And here's where we kind of get into executive functioning. So executive functioning is this kind of high-level thinking, control of behavior. It might involve things like attentional control, kind of shifting focus, having working memory where we hold information online. None of the audience or most of the audience won't remember, but we used to have phone books before iPhones, and you had to remember like how many numbers were, when you wanted to go get some pizza. That's kind of the classic example of working memory. Inhibitory control, which is something I struggle at, where you're suppressing a prepotent or impulsive potential response. and cognitive flexibility. So all these things are kind of critical for us to move through kind of college, but to move through jobs, move through different things in our life. And so what we did in some work when I was in North Carolina was we looked at socioeconomic status when kids were kind of in middle childhood. We got some measures of executive functioning. I would call it neurocognitive functioning here a couple years later. And then we actually looked at their state-related end of grade tests. So these are the things that determine whether somebody actually gets promoted during middle and high school. And so the Pennsylvania equivalent is the PSSAs, but they're called the EOGs in North Carolina. So kind of as you might be guessing already, we looked at executive functioning in relation to SES. We also looked at SES in relation to academic achievement and neurocognition. And what we find is that we find relationships between socioeconomic status and executive functioning, where with more affluent kids, we see a little bit better executive functioning. And we also see that these executive functions are related to academic outcomes. So executive functioning is on the horizontal here, SES is on the horizontal here, EFs are on the vertical here, and these end of grade standardized test scores are on the vertical in the figure on the right. And we do something called statistical mediation, which is trying to understand things using really basic statistical methods. And what we find is that about 37% of the difference in math performance that's related to socioeconomic status is explained by executive functions. So these executive functions have consequences. It's not just something we're measuring in the lab. We think that these are critical things that help kids succeed in the classroom. We can also go back to some of the brain stuff I talked about, and those brain differences also had consequences. We looked at the trajectories of growth in the frontal lobe and the hippocampus, and we found that they related to pretty well-used measures of achievement called something called the Robert Woodcock Johnson in the frontal lobe as well as the hippocampus. And so different kinds of academic domains were related to these variations in the brain and these SES-related differences. We didn't really see it for a bunch of other regions we looked at. So you might be kind of wondering, and I was wondering the same thing, it's like, what is it? What is it about socioeconomic status that might be explaining this? A real kind of like simple, why do you see this? So some data that is unpublished, I just analyzed it this morning, if I'm being honest, was we looked at household income in about 2,000 or 2,800 kids and neurocognitive assessment. So we got these measures of executive function. And we looked at measures of life stress. And the idea, and the thing is that related to some of the things I kicked off the talk with, poverty might be related to greater life stress, and life stress might play this explanatory role, what we call statistical mediation. So why key in on life stress? Partially, I've published a bunch of other work that has like found executive functioning and prefrontal cortex and stress exposure are all connected, and that stress exposure is this really kind of big driver of change of the brain and behavior. His work was published in the Journal of Neuroscience a while ago, but didn't look at socioeconomic status. It just looked at stress. And so how much you kind of reported feeling stress, how many negative kind of bad things maybe happened to you. You guys can think about breaking up with a romantic partner, failing an exam, maybe kind of having a big fight with your parents, or, you kind of name it. Getting in car accidents, yada, yada, yada. So we find that more stress is related to smaller volumes in the prefrontal cortex, is the region we care about, and more prefrontal cortex volume is related to better executive functions. So kind of went back and had this hypothesis this morning that exposure to stress might explain these links between socioeconomic status and executive function. So are there links between SES and executive functioning? Here's data I'll show you. Household income, socioeconomic status is on the horizontal, and the vertical is working memory. And we see, like a lot of things, this positive association. Greater income, greater working memory. So we find this kind of initial link that a lot of people have found that I showed you kind of previously too. It's in a bigger sample, so that's notable. And then kind of related and kind of similar to some other stuff, here's household income, and here's stressful life events. And we see a negative association. The scatter plot's terrible because there's 2,800 people. But I assure you it is a negative association where with greater levels of income, you actually have less reported stress. So with more poverty, lower socioeconomic status, more economic marginalization, we see more reports of bad things happening to you. So we find this. We also find, I didn't include it as a slide here, relationships between stress and executive functioning. And then when we kind of try to take an explanatory role, we find that stress exposure explains about 7% of the differences in working memory. So just a modest amount, but it's kind of starting to speak to what might be driving this. We'll come back to this later. 7%, not that much, but socioeconomic status is a lot of things. And that's one of the things and challenges I think that the field grapples with is there are a lot of things from the material to the social emotional to the environmental. And how we can measure all of those things in one study, difficult and complex. How we analyze those things in one study, again, difficult and complex. I alluded to this a bit, but we find these differences in the hippocampus and overly honest methods or science. I'm still struggling to like what it means. So the hippocampus is this region that we all talk about with memory, but I think that's stupid because memory is not a thing that you actually care about. Your brain doesn't care that you went on a great trip to Paris. Your brain cares about learning and understanding the environment. And that's what memory is. It's stored information. You're using stored information to make new decisions and to figure out new environments. So maybe if you go back to Paris, it's really useful. But we haven't found kind of really good behavioral correlates, I think, of and kind of intermediate mechanisms of what this SES-related kind of difference in the hippocampus really means. We see it a lot in the brain, and we're still kind of looking for a rich behavioral anchor. I have some other ideas, but I'll save it for another time because I have lots more data. So SES is related to executive functioning. We see these SES-related differences in math are partially explained by executive functioning, and that there might be these kind of lagged or different development of the frontal lobe that might be kind of connected to these differences in executive functioning and academic achievement. And that exposure to life stress is one factor of likely many that explains these links between SES and executive functioning. Okay, down to my section here. So this is where I'll just like talk about other people's research that I just kind of nerd out about sometimes. But decision-making and poverty. So related to a lot of this stuff I've talked about, poverty is correlated with stress exposure. We can think about stress exposure is related to changes in decision-making. This week, you may not want to go to the gym. You may be kind of tuckered out and you're like, I'm under a lot of stress. There's a lot of stuff that happened. Whether it's the election or just the semester, you're like, that may change how you engage in the world. And a different way of putting this is under stress, we may prefer short-term gains. I have been in Philadelphia and South Bend, Indiana this week, and the election happened. So I do want to go to the gym. I'm not at the gym. I haven't gone this week. So we may prefer short-term gains. I love Wawa soft pretzels, and that's what I'm doing inside of the gym. Not the best idea from a long-term perspective, but I think about scarcity and how we may not have enough and how that may start to influence long-term planning and delay of gratification. And how economic instability may start to reduce trust in social systems. You may not believe something's going to show up for you because you may have seen things not show up before. And again, this may lead us to have these more short-term interests. We may kind of want to go for immediate tangible things. And to really kind of hammer home this instability idea, this is like my favorite study ever. Many folks may know the very well-trotted Walter Mischel marshmallow task. Here's a marshmallow right now. Wait a couple minutes, you'll get a second marshmallow. But an ingenious, I call it hack, by a colleague now at Berkeley named Celeste Kidd, really took this marshmallow task down a peg, in my opinion, and pushed away from thinking of it as a pure kind of trait idea, where she did this really simple reliability manipulation, where he said, well, we're going to do the marshmallow task. But before the marshmallow task, we're going to do some coloring. And for half the kids, they came in and they plopped down a really shitty bucket of markers. The markers were terrible. They had their caps torn off, and they weren't very good markers. I know this from experience because I have a very disorganized 7-year-old. For the other half of the kids, they said they're going to do some coloring. They delivered them some markers that were also crappy. But they said, oh, wait a minute, we're going to go and get better markers. So for half the kids in this whole study, they said, oh, these markers suck. We're going to go and get better ones around the corner. Or for all the kids, they said that. And for half the kids, they actually delivered. So half the kids said, were greeted by an experimenter. The experimenter said, I know these markers suck. We're going to go get you better ones. They went around the corner and they did it. For the other half of the kids, they said, these markers suck. We'll go around the corner. And they came back a couple minutes later and they said, oh, I forgot. Let's just go do the marshmallow thing. So basically, this has a major shift in willingness to wait. I will draw your attention to, and this just looks like a bar graph, but the vertical axis is in minutes, which is a mind blower to me. I can only hope I will ever have a psychological study that literally these kids are waiting 4 minutes, these kids are waiting 12, 13. That's a big difference because they've literally just seen someone not deliver when they were supposed to. And so I got really interested in this study and some other work, whether socioeconomic status, which I think is sometimes marked by volatility and change, not necessarily at people's choosing, but because of structural problems, would that be related to discounting in adulthood? People have found it a little bit in childhood, but we took this really interesting study that asked adults retrospectively all about their childhood socioeconomic position. And what I'm going to show you here is on the vertical axis is immediate rewards, the preference for immediate rewards for more delayed rewards. Lower SES status is on the horizontal, and the lower numbers, negative numbers, and higher SES is on the other side, on the right side. And what we find is a negative relationship. This is only in 378 people. I'll tell you why that's important in a second. But we see basically a preference for immediate rewards as an adult, mind you. This is like 20, 30 years later. We control for kind of a bunch of current demographic things, but we see this, preference for more immediate rewards for folks who look back and say, my childhood was on the lower end of the socioeconomic spectrum. We didn't have enough. So why I say it's only 378 is there's actually a cross-cultural study of 12,000 people. And so here are all the countries. There's about 60 of them on the vertical. And this will be what's called an effect size plot. But the biggest thing of note is if it goes towards me, that means that there's a preference for immediate rewards in those that are from lower SES or have the perspective of being lower SES in childhood, despite being there now, they don't. And what we see is across 95% of the countries studied, so about 12,000 people, there's like a couple hundred in each one. We see about 95% of the countries this effect. We don't see it in Ghana, Turkey, and Ethiopia, but we see it everywhere else, and that's where the US was. So we kind of think this is like an interesting phenomenon that also might have some cross-cultural legs. I'll try to keep moving because I know I'm almost out of time. I'm running low on time. But I think about how economic stress of more recent times may kind of factor into this. So we wanted to see, well, what if you were kind of brought up as a kid in a lower socioeconomic household? Now you're also facing some economic anxiety. And what we find, I'll unpack this, there's 3 lines for the lower socioeconomic people, the kind of average folks and the folks that are more affluent as kids. And this is kind of more economic challenge over here on the negative numbers. And the idea is if you have had a bunch of recent economic stress and as a kid, you had kind of some economic precarity, you were more likely to prefer these more immediate rewards. This is just simple moderation. Now, turning to the brain, a couple kind of quick brain studies. When we talk about rewards or reward processing and value, there's kind of a connected circuit that encompasses parts of the frontal lobe, but also some other subcortical brain regions. Notably, a portion of the frontal lobe, so our old frontal lobe ROI is shown here, but a subsection of the frontal lobe, the prefrontal cortex called the ventral medial prefrontal cortex, ventral just means down, medial means middle, is involved with kind of comparing and tracking value across objects. And the ventral striatum is a brain region involved with kind of processing lots of aspects of reward and immediate feedback, but it kind of gets at the amounts of gains, the likelihood of getting a reward, stuff like that. And we did this really simple task to learn the value of new objects, where people just were kids, these were 14-year-olds, were given a task and they were told that some of the pictures are good and you'll win some prizes and points, and sometimes the pictures are bad. And we paired that simple task with a computational model. Computational model sounds really fancy, but all it means is you know what people did and what happened. So you go through one trial, you get some feedback, you go through a different trial, and our computational model can start to say, oh, I think you might have a belief about some of these stimuli and what you're choosing and what you're doing. And then you can kind of keep going through, but we know what people are, when they're getting positive feedback, we also know when they're getting negative feedback. And then we can basically have a mathematical formulation that allows us to talk about how valuable we think something is, which is this thing called expectancy value, like kind of integrates some learning weights, and this thing called a prediction error, which is what happens when you get it wrong. And what we find is in this kind of modest sample of kids, it's only like 75 kids, or they're all about 14. We looked at socioeconomic status on the horizontal axis and brain activity on the vertical. And what we again see is these positive associations where the value of positive stimuli start to be related to socioeconomic status. And I'll skip forward a little bit. We find that this actually explains some mental health issues. So we find that income is related to depressive symptoms, and then we find that part of that is explained by value signals in the ventral medial prefrontal cortex. For the other part of the reward circuit, this ventral striatum, we see a slightly different pattern. This is actually in about 8,000 kids. And I got really interested in this idea of like thinking about variability. So we can measure the average level of stuff, but sometimes brain regions can have the same exact average level, but they have a lot more variability. So some brain regions, you've seen on the left, is just a kind of schematic, have bigger standard deviations, different kinds of temporal dynamics that kind of get at variability and change, versus others, not so much. And what we find is ventral striatal variability during positive reward trials relates to household income. So there's actually greater variability for those that are economically marginalized. And this relates to some stuff about externalizing symptoms or having problems with aggression and rule breaking. So I'll kind of quickly close up this section and just say, we're really interested in like kind of ideas of discounting and decision making and how you may value rewards and whether that relates to these early kind of child socioeconomic poverty experiences. And what we found is that in adults, 12,000 adults, we find this preference for more immediate rewards. If you look back and say your childhood was a little bit more precarious, more financially challenged, this is often heightened by economic challenge, more recent economic challenge. And we find a bunch of brain regions involved with value and reward processing showing some differences and that relating to socioeconomic status and income. And this is also connected to some aspects of mental health. So last couple of studies I'll talk about. So in a lot of this work, we've been talking about household income. We've talked a bunch of you about this. But poverty is, as I noted at the beginning, it's a pretty complex, multidimensional thing. And so my team at Pittsburgh has been trying to think about this and expand our research focus. And I was profoundly influenced by the sociologist Matthew Desmond and his book called If you haven't read it, I highly recommend. Desmond kind of ethnographically charts rooming houses and the challenge of housing instability in Milwaukee, Wisconsin, and kind of paints a really grim but powerful picture of how eviction, one thing that happens a lot more to poor people, has these intense effects on our psychology and our well-being. And so really recently, I got access to a bunch of cross-sectional data about people's stress and concern about eviction, foreclosure, or condemnation. And what I'm going to show you on the horizontal is a parent's concern about eviction, foreclosure, or condemnation. There are different kinds of housing loss. And that parent, the same parent, so there's some problems there, their report of whether their kid has a depressive disorder, some issues and challenges with their mood. And what we find is in a sample of about 36,000 kids, a modest increase in depression endorsement in relation to this eviction stress. Of note, it's actually after controlling for their poverty, homelessness, perinatal factors, prenatal complications, previous moves, childhood adversity, parent education, mom's mental health, more covariates than I could, really kind of note here. So we see this, and we kind of think this is an interesting space to kind of work with. And we actually see it across a couple different disorders. Not all mental health problems are related to eviction. We don't see any differences statistically related to behavioral or conduct problems, so kind of getting in trouble at school, things like that, reading keys and having challenges with attention. But we do see a modest increase, about 5%, with anxiety disorders. These are, again, parent reports, so there's some challenges there, and depression. So we can start to think about, let's expand out. It's not just about income. And to hold on that for a moment, income is actually really complicated. I saw a few kind of grimaces and disbeliefs about that. But what I'll say is, we talk about income in a really static form. We talk about income like you make $35,000 a year, or you make this amount of money at or below the federal poverty line. But that's not really how people get money. Yes, maybe you have a job that's salaried and you get money that comes in, but lots of people don't. Lots of people have seasonal work, non-traditional work, extra legal work, gig work. And there's been some really nice work actually from JP Morgan. I think it's from JP Morgan. JP Morgan Chase looking at people's financial diaries. So they have people kind of give detailed records. So think your diary where you put your most intimate thoughts, but instead you're just talking about your money. And you do this every week. And what they found is wild swings in people's income based on where they are in the socioeconomic status, but just in general. So these are the particularly working poor, sometimes have swings as much as 70% per week and per month. There's actually some variability as you go up to the high end of the spectrum, but you can think about, we talk about income in this like really static way, but if you think about, I need to make it to the end of the month, I need to feed myself or my family. If you do not have the money to do that, that is tough. And it is not that you just have $24,000 to equally like divide up throughout the month. Money comes and it ebbs and it flows. And so in some work my colleagues and I have done at the University of Pittsburgh, we repeatedly sampled income from about 104 adolescent and parent dyads. What I'm going to show you on the horizontal axis is a time point in months. So every month we went back to families and asked them about their income. And we asked them from lots of different sources. They got very annoyed at us, but they told us. And on the vertical axis is basically a percentage of money in terms of the amount of money you'd expect to get based on your past year's income. And so this is basically like what you're expecting for this month, like based on your last year, like we just took their annual income and divided it by 12. And what I'm going to show you is the more affluent folks. And basically you can kind of see it hovers around 100. There's still some swings, still moving up and down. But for the low SES folks at or below the poverty line or really close to it, you can just kind of see the variability. And so each line is an individual family. And so, again, sometimes we're going up or down, between 0 and 300. So again, this is seasonal work, this is gig work, this is people doing Uber Eats, filling gaps when they need to, or just trying to get ahead when there's a big cost coming up. So we talk about income, but we talk about it at a yearly space, which I think is where we do ourselves a disservice. The last thing I'll just talk about is also this notion of wealth. Many people may think they know what wealth is, but they're probably wrong. Wealth is actually your assets minus your debts. And then people talk about net worth. The crazy thing is, net worth does not come into any social safety programs. It doesn't matter what your net worth is. And your net worth can be negative because you can have a bunch of debt. I'll talk about that in a second. But food stamps, WIC, any kind of other kind of government social safety net, no one cares if you have assets. No one cares if you have debt. They just care if you have money, like what your income is. I think there's lots of concern and there's lots of kind of ideas of like income inequality and income inequality incomes being very disparate between racial and ethnic groups. Wealth is worse, way worse. So here's income for Black, Latinx, and white. That's income, and here's for wealth. And I think if I'm right, it's like something for every dollar of wealth that a white family has, a Black family has a penny. which is staggering, shocking, and nothing we touch on in terms of public policy for the most part. We don't go near this. We don't try to deal with any racial wealth gaps. And wealth has pretty big implications for child development. And wealth can be negative. I've sadly kind of learned a lot about different kinds of debt and negative wealth that you can have. So debt can be kind of complex, but there's medical debt, which we all probably can think about. But then there's like predatory lending, payday loan stuff. And then I've been just shocked and saddened by things like incarceration debt. So to sometimes cure your parole violations or parole elements, you got to pay off your fines, and they have credit card style interest. I also think about, it's a sad thing that's happened in the US where like online gambling is just an easy way to drive up your debt. So it's an easy way to basically put yourself into bankruptcy and push yourself into high levels of negative wealth. And there's been really kind of powerful work starting to talk about debt and children's social emotional well-being. Okay, so I've perhaps been wildly depressing. I'm sorry. Poverty is real, and we just have to face that in our world. But I want to just say a couple things to note, perhaps to leave on a happier note. Reducing poverty can lower these potential negative impacts. And I want to go back to where I was a postdoc. I didn't work with these people, but this is the state of North Carolina, if you're a geography nerd, or if not, I'm telling you it is now, and you can't tell me I'm wrong because I'm right. And these folks worked in the Great Smoky Mountains, the western part of North Carolina, highlighted here. And they were psychiatric epidemiologists, which means they were just charting the basics of mental health problems happening at a population level. And while they were doing this, a funny thing, quasi-natural experiment, people would say, happened, where a bunch of folks who were in this region were American Indian Native folks, and they got gaming rights in a little part of the Great Smoky Mountains. And so they could open a casino. And if you were part of the tribe, you got $4,000 just for being part of the tribe. You didn't have to work at a casino. If you could prove that you're a Native person, you got the money. And interestingly, this created three groups: the never poor, the affluent folks; the persistently poor, the folks who maybe were in the region but couldn't prove that they were Native or weren't actually Native; and then the ex-poor. So basically, you once were poor, but now you got a check for $4,000. So it helps you pull you out of poverty. And it's really powerful work that appeared very long time ago by Jane Costello and Andrea Mangold and colleagues, looked at the mental health problems of folks pre-casino and post-casino. And the mental health problems are shown on the vertical axis. And perhaps, as you might predict, the affluent didn't really have a lot of mental health problems. The persistently poor had a fair number of mental health problems. And the important thing, and you probably can get it by my giant tee up, is the ex-poor is really where the action is, which is they started with high levels of mental health problems, but we just gave them money and literally things got better. Poverty is hard, it's difficult. And that reduced the mental health toll happening to these families. And that is you don't have a casino happening all the time. But there's lots of state level initiatives that have effects too. There's lots of work and people thinking about in the Philly area, but you got things like Medicaid, you got subsidized housing, and you got SNAP, you got WIC. So again, I just did this morning, but there's some really interesting state level data and a giant data set with all the eviction stuff I talked about earlier. But I computed I created a composite of all these state level variables and how good they were at combating poverty. So if you had generous WIC or SNAP rates, if you had high levels of subsidized housing, if Medicare cutoffs were a little bit more richer in your state. And I looked at these things, and basically, here's the state anti-poverty programs. This already controls for poverty status, so whether you are poor, it's about 36,000 kids. But these state level poverty programs cut the incidence, or at least the association of having a developmental challenge by about 5%. And so that's pretty good, it's not nothing. And so we can think about funding these programs well could be powerful and useful. And interestingly, some other data from some colleagues in Oregon and Harvard find that some of this data, you can even see these effects on the brain. So this is work by Katie McLaughlin and Dave Weissman was the first author, But they looked at state level factors, a lot of state level things I just talked about, and then they looked at our old friend, the hippocampus. And what they found is the same kind of association with income and the hippocampus. Well, they broke it down by states. Some states, like California, nicer anti-poverty programs, and some states, like in a lot of the kind of Black Belt of the South, not as generous. And there's pretty big variation. So there's a kind of big amount of variability, but these state level macro policies impact the brain. And I think about how there are so many things, so many ways to get involved that we could be kind of trying to build this. So really great example right here in our backyard, Little Harrisburg. But there was a House bill that was about eviction seals. So if you read Matthew Desmond's book, one of the challenges with eviction is it's a little bit of a scarlet letter. You get evicted once, you can't get back into housing well. We were going to have an automatic eviction seal, but that was sadly tabled by the PA House. But these are things that are very tangible policy things that you could call your local reps, and if they get 50 calls, that's going to move the needle as opposed to anything at a national level. So quick kind of summary. SES is complicated. It isn't just about money. Stress from housing issues can be linked to these mental health issues. There's lots of variability in terms of month-to-month income that I think we just need to look at. Also, there's lots of things with wealth. Wealth doesn't get integrated in any social safety net program. So you could be the same person. Two people could be making $24,000 a year, but one of them has $50,000 in medical debt. And that's going to just be a really different psychological experience that we don't even touch. And lots of programs can reduce poverty's negative impacts, and many of which we could even have a hand in potentially pushing forward or at least supporting. So these are the things I said at the front, but we find these differences in the hippocampus and the frontal lobe. We kind of look at and think about executive functions. We find these kind of changes in some reward processes related to SES and value-based reward learning brain regions. And poverty is multidimensional, but there's still a lot of ways to move the needle. Again, it is a cheesy and slightly cliche way to close, but I do go back to this MLK quote, but only if we pull. And so only if we pull, we might be able to bend some things for those that may not have enough. And with that, I'll kind of close out. Thank all the folks at Pitt and various other places I've worked, and then kind of be ready for some questions. So